So that's a quick update on semaglutide. It's a program that works. I have to tell you, I've used it myself successfully and have not had any side effects. But then again, I do follow, as I mentioned in the webinar, I do follow dosing rather religiously. What I'd like to do right now is introduce Turner Davis. He's joined us for this particular webinar. He's going to be helping us with the Q&A. And also, please be aware that we're going to be providing you a copy of the deck, link to the video, and support information on how to get a hold of the New Horizon Clinic to get the semaglutide program going at the end of this as a follow-up in an email. So Turner, thank you very much for joining us.
Yeah, no, absolutely, Mark. I appreciate you having me on.
So you've been working on this program for a while. I think I know you've had some interesting successes with it. You want to tell us a little bit about that, and then we'll jump into the questions.
Yeah, no, I mean, just overall, patients have, and I think we've seen not just with our program, but just generally, with Ozempic and the semaglutide compounded products, patients have had good success losing weight, and it really does. It really is a novel and new way to address the obesity issue that we're all dealing with, and it works well for folks. So, yeah, I mean, certainly I would encourage anyone that's interested or that's maybe on the fence, I would give it a shot because I think all of my family members are on it at this point. I've been using it, so it really does help.
Yeah, that's really something interesting. Let's jump into some questions that were sent to us prior to the webinar, and we can maybe get those answered. And I might want to point out to everybody there's a little Q&A button at the bottom of your screen back over here. Please feel free to ask any questions you might have about semaglutide. We're here to get your questions answered, and then we're going to jump into now some questions that were asked beforehand. First question is, will I experience all the side effects I see online? I think you'd have to work very hard to get all of them. But Turner, I think that really they're kind of targeted as opposed to being all at once. Is that safe to say?
Yeah, yeah, exactly. A lot of it has to do, the most common side effects really have to do with the type of diet that you're eating with the medication as well. So, especially when you first start the semaglutide treatments, you really have to be aware of, not overeating or not eating, really fatty foods or foods that, it's not basically when you start taking semaglutide, it doesn't mean you can eat a whole plate of lasagna and you won't gain any weight. I mean, that's not how that works. And if you do overeat on it, it can give you some GI side effects like the nausea, or like vomiting, and other type of GI side effects, which are the most common that certainly we see with it. The other issues with the more severe issues are just very, very rare. There are millions of people literally taking semaglutide, and there's just very, very few of these severe side effects out there. But it is something to be aware of. And if you do start having symptoms, severe symptoms, or GI pain, those sorts of things, it is something you definitely need to let your provider know about as soon as possible.
Yeah, and in talking to a number of folks, practitioners that are helping patients, I think the main issue that we see is, or at least they see, is really pay attention to following the program, follow the dosing. Don't
Yes,
push it too
yes,
hard too quick. There are a lot of people that do that, get into difficulty. And I think the other issue is a lot of people think they can eat their way through this, that
yep,
you can eat as much as you want. And really, it causes your body to just not be as hungry. And it's important to
yeah.
listen to that because that helps you lose weight.
Yeah, exactly. I mean, that's the positive thing about semaglutide is you don't necessarily feel like eating, overeating a lot of times, and it really does kind of help uh, eliminate some of those cravings for sure. So,
Sure. Let's jump on to the next question. It's here.
yeah, so safety semaglutide, we were talking about that here as well. It's just really well tolerated, and I think every drug you look at you look at on a risk versus benefit ratio. Is the drug does do more harm than good, and the amount of good that semaglutide does compared to the low risk of side effects really makes it an attractive therapy for weight loss, because we all know the side effects, or the complications from obesity and being overweight are very serious and very severe over time, especially. So if we can find a medication to help us, handle that, then it's certainly worth looking at.
And I think the other thing about the safety is this has gone through five trials over a long period of time, over
Yes,
over almost a
absolutely.
decade. And so there's very few products that are on the market today that have gone through that rigorous of a testing prior to being
Yep.
put on the market and being available. So I think that's
Exactly.
something to pay attention to as well. How do I give myself a shot? Uh, I don't know about you. I don't wake up in the morning wanting to give myself a shot. That wasn't
Yeah.
one of the things, but it's something you
Yeah,
have to do. So why don't we
yeah,
walk through that just
absolutely.
for a minute?
Absolutely. Yeah. I mean, it is, it does take a little bit of practice to get used to filling up the syringe with the vial and giving yourself the injection. After 4 or 5 times of doing it, it becomes, old hat. But first few times you do it, it can be a little awkward. But the nice thing about the injection is that it's a subcutaneous injection, which is a very small needle. You're giving it right into right into the fat layer, right under the skin.
Hmm.
And usually areas that aren't very sensitive, like like in the stomach or somewhere, an area like that. So really, the pain level as far as that goes for the injection is about as close to zero as you can get for sure. So
Yeah. I think, and we should point out that we put together 3 videos on our website. So when you become a patient, those videos will actually show you how to take the shot, how to fill the syringe, and and the precautions and how the whole process. So we kind of walk you right through that, not just through text, but also with video to help you with that quite a bit. And I think that's something that helped a lot of people. My
absolutely,
biggest issue was getting used to filling the syringe because obviously you don't want to let any air bubbles in the syringe. And I
yep,
just had to get used to doing that. Not complicated. It's just I've never done it before, so it was kind of my big issue that was
yeah,
there.
yeah.
And the other question is, can I have my shots delivered to the clinic? I think
Yeah, so you wouldn't have them actually delivered to the clinic but you'd have them delivered to your home, and then if you wanted someone at one of these locations to assist you in giving the shot, just bring that into the clinic, and one of the nurses there can assist you with giving that injection. But yeah, if you live somewhere conveniently close to one of these 4 locations, we can certainly assist you in doing that.
great. And then the other question is there an oral form? I think they're working on that. I don't know if it's out yet. Yet.
Yeah, they are pretty much every company is working on an oral form of the medication. There is an oral form actually of semaglutide out there. It's not been shown to be quite as effective as the injection for weight loss. It's more mainly used for the diabetic treatment. But there is one out there. It just as far as weight loss goes, doesn't have quite the potency that the injections do for that.
Now, one of the other questions people have is how do I store the medication? And candidly, how long can it be unrefrigerated?
The medication is good for 30 days refrigerated. The commercial products actually once you open them, you don't have to refrigerate them for the rest of the the 4 weeks that you use the syringe. But for the compounded product, we do recommend that you do keep it in the refrigerator. And the expiration date on those are 30 days. So
Sure. And really don't keep it outside the refrigerator. Keep it refrigerated. When you fill up that syringe, take that shot, put it back in the refrigerator right away. Don't leave it
exactly,
on the counter for
exactly.
a while. It's not going to help you very much. The other question is, do I have to stay on this long term?
You know, uh, there's no there the studies that they've done. There's really no downside to staying on it. Now, obviously, there's a cost factor involved in staying on the medication long term. But from a therapy standpoint, from a treatment standpoint, there's really no, uh, you can certainly become a lifestyle type of medication, something that you would take once a week for indefinitely. Because it does again help control those blood sugar spikes, helps control inflammation and those sorts of things that we talked about in the webinar, and those benefits don't go away over time. And the side effect profile, the long, really again is so minimal. There's really not a lot of danger or harm to staying on it long term.
Yeah, but I noticed that, like in my case, I'm starting to reach my goal. I'm looking at actually starting to wean myself down instead of it's taking a high level, kind of cutting it down by 20, 30, even as much as 50%
Yeah,
over a
one
period
thing.
of 6 to 8 weeks to really wean myself, get myself back because I've learned to eat better. I've learned to not eat
Yeah, no,
everything in
exactly,
front of me.
exactly. Well, one thing people have been there's been some articles out lately about microdosing semaglutide. That's a term that means using a very small dose on a weekly basis, usually 0.8 milligrams, I think is what people will use, and that is something that more and more people are looking at doing, and that sort of helps mitigate the cost and the side effects because you're using a lower dose, but you still get a lot of the benefit from the lower dose that appears. So it's
Yeah,
just something to maybe look at too.
yeah, and I think your healthcare provider, the person that's working with you, will walk you through that and help you with that
Yeah,
quite a
no,
bit,
exactly,
which is
exactly.
one of the benefits of having somebody again. why have a safe program? Why don't you just buy it over the counter and use it? Because I think working with somebody and getting your questions answered, little tips can make a huge difference in the success for your program.
Absolutely, absolutely.
The other question is, can I still drink alcohol?
Yeah, I mean, it certainly it will cause an increase in side effects. It will hamper, as alcohol always does, the amount of weight that you lose. So we do really try to minimize the amount of alcohol that patients use while they're taking semaglutide, for those weight loss goals. So yeah, obviously, it's not dangerous per se, but it's something that you're really going to affect your weight loss goals if you overindulge in alcohol on a regular basis. So
Yeah. I think if you have a drink, I know that I've had a drink and it really hasn't had much effect on my body.
no, no,
But I
once
think
in a
if
while,
you get 5 or 6 drinks or go out just to have a party, I think then you will have some sort of
exactly, exactly.
impact on it.
Yep.
Let's next question is, if I still have cravings, can I increase my dose? Can I increase my dose early?
Well, the thing with the reason we ramp up the dose, that protocol is there is because we want to avoid the more serious side effects that can occur in patients that seem to be more likely to occur if they start off at a higher dose.
Mhm.
So it is something you just want to talk to your physician about on that. We do have to be a little cautious on how fast we raise the dose with patients. But it is something that there is some flexibility to, and it is something that you can discuss with your provider.
Next question is, what happens after month 5? I think we were just talking about that, about either continuing or weaning yourself off. Your
Yeah,
thoughts on that?
so it's exactly. You can either try to wean yourself off, or if you wanted to maybe go back to like we talked about, using a small dose on a regular basis, or we can continue on the medication. Sometimes if but the thing I've noticed about using the semaglutide long term is it does it's easier to get the weight off. If you do put a little bit of weight back on, if it's easier to come back off if you're using the semaglutide. So it's just easier to manage for me at least. So it is again, but again, that's a cost factor. So it's really up to the patients. You can always stop it and then start it again in 6 months if you need to, or so. There's no real downside to stopping and starting the program other than just having to start over on the dosing.
But I do think weaning yourself off, just don't stop cold turkey. After month 5, if you
Yeah,
wanna
no,
get
exactly. Yeah, I think any medication, especially that affects your metabolism like this, you want to wean yourself off, not just stop cold
and
turkey. Yeah,
if you really pay attention to your body and you reduce a lot of the cravings, you realize the good food to eat versus the bad food to eat, you realize what it has on your body, and you stick to that regime, it'll actually keep you at that level because a calorie increase, the calorie count isn't really increasing that much. But
no,
I do think
exactly,
that it's
exactly.
something it does change it does change the behavior and how you eat. I can tell you that. The next question is, how much will it cost to get treated with semaglutide? Will my insurance cover this?
Yeah, I know we discussed this in the slide earlier, but as far as the insurance coverage, some insurance companies will cover it. It's a pretty small percentage, and even a smaller percentage that will cover it for weight loss. But there are, you can go through the prior authorization process with your primary care provider. We don't at our clinics we don't do the insurance side of it because again, then you're using the name brand drug. Just it comes from a pharmacy. The compounded product is not covered by any insurance. But it is a more cost-effective alternative to paying out of pocket for the name brand drug if it's not covered by your insurance. So, but
Mhm.
there are some that will cover the name brand products out there, which is something to check with again your individual insurance provider on.
I think that covers a lot of the questions that were asked prior to the webinar. Let's jump into some of the questions that were asked during the webinar. Does the indigestion and nausea go away eventually?
It does. Yeah, it usually resolves pretty much completely within the first 30 days after you start the medication. Or it may take 60 days for some patients to completely go away, but it does, as your body adjusts, it does go away.
Yeah, it's a matter of your body getting adjusted to it as well. I think
Exactly.
that's important,
And adjusting your
especially
diet too, that has a lot to do with it. So,
especially if you're coming off of a diet that has a lot of fats in it, and that
exactly.
that
Exactly.
really your body is not seeing as much fats and it's adjusting to that, and that's where you're getting into
Exactly.
the indigestion. Have skin problems been reported?
I have not seen any significant skin issues. I know usually with any weight loss program, your skin can dry out a little bit is because as you lose weight, you're losing some nutrients there that your body had. You can there are some vitamins out there, hair, skin, and nail vitamins that you can take Some people do have minor hair loss. Again, that's with any weight loss program. Once you start to lose weight, sometimes that will happen for a short period of time. So those types of problems, dry skin, if you're prone to it, especially, can eczema, those sorts of things can flare up a little bit, especially in the early days as you start to lose weight. So.
Yeah, I haven't seen any skin problems, at least for myself or the people that I know who are taking it. Is medication okay for people with stage 3 kidney disease?
Yeah, if you have active kidney disease, we do. It's not recommended that you use semaglutide therapy. So yeah, our providers, you can something you can talk to your kidney, your nephrologist about, or your primary care physician, but not something that we would do in the clinic. I believe it is a pretty strong contraindication. So.
Is there a long-term side effect to semaglutide?
Again, this is always the big question with a new drug. It's only been out, again for being used in large numbers for about 5 years or so. So we don't really know fully what the long-term effects are, but again, looking at the mid-range effects that we do have a record of, they're very minor, and it doesn't appear there's any sort of long-term damage that's occurring. There's no evidence of it, at least at this point anyway. But it is something to be aware of that, we don't know if someone has taken semaglutide for 15 years because no one's done it yet. So we do have to kind of wait and see on that.
Yeah, as you mentioned, it has been studied. It's been out there for over a decade. There are some long-term effects, although we've talked about a lot of those. Most of them are mostly minor.
Yeah,
What it's
exactly,
doing,
exactly.
it's putting your GLP-1 receptor back in balance, back in homeostasis,
Yeah,
and that really helps
yeah.
quite a bit. And
Yeah,
if you
again,
do it
there's absolutely no evidence that there's going to be any long-term detrimental effects from it. But to say it with certainty is just unfortunately, you do have to kind of wait to get the data. So
but getting that GLP-1 receptor back in line has really helped quite. At least for me, it's helped me
again,
quite a bit.
yeah, exactly. With that risk-benefit ratio, like we talked about, it's nothing is there's nothing that it will do that is as bad as what being overweight would do for that same period of time. In my opinion. So
Pain to gain ratio. What do
exactly,
you got
exactly.
to weigh that. Let's run into some of the questions that have been asked during the seminar. Cheryl asked a question: can I use it if my gallbladder was removed 30 years ago?
Yes, you can. That there is no contraindication for Ozempic and gallbladder removal.
Mhm.
So it is fine to do that.
DJ asked an interesting question. My side effect is heartburn. Any thoughts?
Yeah, again, that when you start, you know, I suffer from this a little bit too. When you stop eating as much food, sometimes when you don't eat enough or don't, change your diet, the heartburn can be an issue. Just being really conscious of what you eat, sort of testing out, the food and the time that you eat too. You don't want to eat too late and then lay down. Obviously, that can cause heartburn issues too. But
Mhm.
taking some if it persists, something you could take some over the counter Pepsid or uh, omeprazole until that subsides. Your body should adjust to that. But again, in the beginning, especially as you change your diet, it can certainly, if you're prone to heartburn, like a lot of us are, that can certainly flare up. So.
Yeah, yeah. And like you mentioned, there's some heartburn medications you can take that don't react or don't have a
Yeah,
problem.
exactly.
Other question. Cheryl asked another good question: is metformin similar?
Yeah, it's a different mechanism of action, but it is similar in the fact that controlling the spikes in blood sugar can give you some benefit. I know a lot of people do lose weight when they start taking metformin because the action on the blood sugar and the insulin spikes are similar in that it doesn't affect those GLP-1 receptors. It doesn't make you feel less hungry or make you feel full like the Ozempic will, but as far as the effects on the blood sugar, it can be have similar effects, not as strong. There's a reason why metformin is not prescribed for weight loss. It's not a strong correlation like it is with semaglutide, but it can benefit some patients for sure on that. So
Yeah, metformin has a different process that it's using
it
and
does,
attacks
yeah,
it in a
different
different
mechanism of
way.
action.
So it's not
But a great drug.
dissimilar. And
It's yeah, absolutely great drug. A lot of anti-aging clinics will use metformin just because it has a wide range of positive benefits. Again, anti-inflammatory and anti-aging effects and things like that. There's more studies they've done. Again, metformin has been out for a long time. They've done a lot of studies on it, and it does have a lot of positive benefit, especially for the cost. It's very cheap too. So
Well, Turner, we've exhausted all the questions, covered a lot of very interesting topics. Any last thoughts?
No, yeah, I just appreciate everybody's time. It's been certainly a big buzzword, the semaglutide and Ozempic over the last 12 months or so. So, being able to get a little bit of information out there for folks, appreciate everybody helping out with it. So,
And I can tell you, as a senior, I'm a senior citizen, and just losing weight has been a challenge. I've been trying to do that for a long time. I had an auto accident that caused me to gain way too much weight than I wanted to gain, and I finally got my weight under control again by using this. I lost about half the weight I wanted to, kind of on my own, but boy, the other half, I was not making any progress. I was just pure stuck, and I think a lot of it, you go back to talking about getting that GLP-1 receptor in line. It really did make a difference for me,
it does. It
my
absolutely
body
does.
reacted
Yeah.
very quickly, and has been. I've been feeling a lot better, and I have to tell you, when you lose a little bit of weight, your whole overall body feels better. Cool.
Yeah, no, absolutely, man. Absolutely. So,
Good. Well, listen, Turner, thank you very much for providing the product. I do want to point out to everybody, the key to this is to have a safe weight loss program. That's really the key. You need a doctor or some medical professionals' help to be able to do this. Doing it on your own, you might be able to do it, but I'll tell you, at least in my case, I found it to be really tough. And I want to thank everybody for tuning in to this particular webinar. I do want to mention this is the last webinar we're going to be doing this year in 2024. We're going to be having a whole new program starting in 2025. I might want to mention we're going to be publishing within the next week and a half the schedule for next quarter. And what we're going to be doing is something that's rather exciting. We're going to be walking through for patients that are interested in medical cannabis. We're going to walk them through what we call the journey. What do you do month 1 through month 6 taking medical cannabis? And even people that are new to medical cannabis or people that have been using it for a long time, they'll find that this particular series of webinars is going to be very informative. I want to thank everybody for joining me tonight and joining Turner. Hopefully, it just helps one person get their life back. We've accomplished what we wanted to accomplish. As mentioned, you will be getting a copy of the slides, a link to the video, and the follow-up material. Thank you very much. First of all, everybody, thank you for watching for the last year. Thank you and have a great holiday season, and please stay safe.